The family safeguarding model means that families that we're working with are able to access support much quicker, linking in with the adult workers in terms of domestic abuse, substance misuse, and mental health in terms of our recovery and wellbeing workers. It means that there's not lengthy referral forms, nor are there lengthy waiting lists for families to access that support, which is very much needed at that time, meaning that the correct interventions can be offered and that the right support is in place for our families.
The changes I've seen with families I'm working with is incredible. We have been able to reach out to families and offer parents and carers support whilst empowering them to be the best they can be for their children at the same time.
One of the immediate benefits of the domestic abuse adult team is that we can respond quickly. Ordinarily, a high proportion of cases progress via the police to the lighthouse to our community SPOC team. Being in-house allows us the flexibility to immediately investigate the domestic abuse concern.
What we have done is we have removed the stigma around drug and alcohol support, and we have taken the support to them in their own home, where they feel comfortable, more relaxed to work with us and open up with any issues that they may actually have.
Some families have given some really good feedback in terms of the access that they've been able to gain to services, and just how they feel supported by children's social care. Some families who have worked with children's social care previously have stated that they can see a shift in the support that's being offered and the way of working.
I've recently supported a mother of two with her alcohol use, and she's now volunteering with us in Somerset Drug and Alcohol Service, helping others in service. I feel this would not have happened without the family safeguarding model. Being able to work so closely with social workers, domestic abuse workers, and mental health workers is invaluable, and we are able to work better, more efficient, and quickly for the families because of this model.
I'm currently working with a perpetrator of domestic abuse. We're exploring his emotions behind his anger and introducing healthier responses to enable him to be a better father to his children.
I've got one family in particular who are working with all three of the adult workers. We've actually got two different recovery and wellbeing workers involved because mum and dad felt that they would benefit from working with one of the recovery and wellbeing workers. So that's great that across teams we're able to share the adult workers, again ensuring that the families that we're working with are receiving the right support.
So families, we believe that everyone deserves to belong. So we recruit and train volunteers from the local community to get alongside and build relationships with families because we want everyone to feel that sense of community and that sense of belonging. And our model fits brilliantly with the Family Solutions Somerset model. We are very much focused on what the family need and the family lead the support that they give. And that means for a mum, it might be that she says actually she wants a volunteer who's going to get alongside her and build that relationship with her. It might be that she actually says, I want some support for my son, and we're able to find that support and put that support in place to make sure it's, I say, the family that are leading that support.
I'm the Advanced Practitioner in the FDAC team, which stands for Family Drug and Alcohol Court. Launching FDAC in Somerset as part of the Family Solutions umbrella last year has been really positive. One positive scenario has been supporting parents to build better relationships with professionals. This has been internally with children's social care and externally with wider agencies such as the mental health team and drug and alcohol service. The parents have reported that they feel valued and heard, where in previous proceedings that they have experienced, they feel that they have not been listened to. This for me is a significant difference between FDAC and standard care proceedings.
Pause Somerset launched in June 2020. Pause works with women who've had multiple children taken into care. In the last 12 months, we've worked with 20 women. 18 of those women are still with the service, and those women have had between them over 60 children removed into children's social services care. We work with women in a trauma-informed way, supporting them around the challenges that they face in a way that motivates them and in a way that gives positivity for the future. Some of our huge successes with women this year have centred around accommodation, around their relationship with their children, and around their motivation for change for the future. We're optimistic. With additional support, those women are going on to do some incredible things, and the relationships with their children are improving day by day.